If you're over 70 and taking Eliquis or Xarelto, your cardiologist almost certainly gave you a list of things to avoid. And that list was probably about food. What wasn't on it is what we need to talk about. Because the interactions most people on a blood thinner are never warned about aren't at the grocery store. They're in the medicine cabinet you open every week without a second thought. Here's the tough part to hear. A 2025 study found that over 90% of patients on these medications were already taking at least one of them. Mary was 74 the morning she noticed the bruising on her forearm. She'd already explained it to herself 3 different ways. Thin skin from age, the door frame she'd bumped last week, the blood pressure cuff at her last appointment. She'd been on Eliquis for 18 months and doing everything right. No grapefruit, no green smoothies, nothing that sounded like a blood thinner. What she hadn't thought to mention to anyone was the baby aspirin she'd taken every morning for 7 years, the Pepto-Bismol she kept for the reflux that came and went, or the Zoloft her GP had prescribed 2 years before her atrial fibrillation diagnosis. Those weren't medications to her. Those were just things she took. There are 4 things in the typical medicine cabinet that interact with Eliquis and Xarelto in ways most patients are never told about. 1 is a stomach remedy most people don't think of as a blood thinner. 1 is an antidepressant that may have been prescribed by a completely different doctor who never saw your cardiology chart. And the 4th is a timing rule built into the Xarelto label itself that most patients were never shown. The people who never hear this keep following the food list and leaving the medicine cabinet unchecked. The ones who do hear it know exactly what to look at and what to bring to their pharmacist before the next cardiology appointment. We're going to walk through all of it. Before we get into the baby aspirin, the Pepto-Bismol, the antidepressant connection, and the Xarelto timing rule, I want to ask you something. Have you or someone you love experienced unexpected bruising or bleeding while on a blood thinner? Tell me in the comments. Your experience may be exactly what someone else needs to read today. Let's get into it. Eliquis and Xarelto work by making your blood clot more slowly. That is the job. It protects you from stroke. But anything else you take that also slows clotting, even a little, adds to that effect. Think of it like a faucet. Your blood thinner is already opening it partway. Anything else that turns it further can push you past the point where a small bump or a cut becomes something that won't stop. The problem is that several very ordinary things people reach for every week do exactly that. And they don't look like blood thinners at all. Your kidneys also matter here. After 70, kidney function often declines quietly. No symptoms, no warning. Eliquis is cleared partly by the kidneys. So is Xarelto. When the kidneys slow down, these drugs can build up in your body at a higher level than your dose was designed for. That buildup makes every interaction we're about to discuss hit a little harder. You don't need to know the percentages. Your doctor does. What you need to know is that the medicine cabinet matters more than most people realize. Adding aspirin to Eliquis nearly doubles your chance of a serious bleed each year, from 1.8% to 3.4%. That's not a projection. That's the finding from the clinical trial that got Eliquis approved, printed on the FDA label. And nearly 1 in 3 Americans over 70 is still taking daily aspirin. Most started years before anyone put them on a blood thinner, and nobody ever told them to stop. That data comes from a 2024 study that looked at health survey responses from over 186,000 people. What that means for you. If you started aspirin years ago for your heart and were later put on Eliquis or Xarelto, those 2 things may still be sitting together in your daily routine, and the combination carries a real cost. Before we get to the part most people never hear about, if you want health information that actually applies to your situation after 70, hit subscribe and turn on notifications so you don't miss it. Okay, let's keep going. Here's one most people genuinely don't know. Pepto-Bismol, the pink bottle in the medicine cabinet for an upset stomach, contains the same active ingredient as aspirin. Each tablet is roughly equivalent to about half an aspirin. The drug facts label actually says not to use it if you're taking blood-thinning medicine. But it's sold as a stomach remedy. It doesn't sound like aspirin, and almost nobody connects it. A 2025 study that looked at 60 patients on Eliquis found that over 90% were already taking at least one product like this. Most had no idea there was any interaction to worry about. The same issue shows up in cold and flu combination products. Ibuprofen, which is a pain and fever reducer that also slows clotting, is often buried in the ingredient list under a brand name that reads as cold medicine. What that means for you, The pink bottle and the cold tablet are worth checking before you reach for them. Taking an antidepressant, Zoloft, Prozac, Lexapro, alongside a blood thinner increases the risk of serious bleeding by about a third. Bleeding inside the skull goes up by more than half. Those numbers come from a 2024 study that tracked more than 42,000 people. And the risk is highest in the first few months of taking both together. This is 2 prescription drugs, often written by 2 different doctors who never compared notes. What that means for you: if you were prescribed an antidepressant at any point and are now on a blood thinner, both your cardiologist and your prescribing doctor need to know about that combination. If you take Xarelto at the 15 or 20 milligram dose without food, your body only absorbs about 2/3 of it. The other third doesn't make it in. That means there may be days where your stroke protection isn't at full strength, and you'd have no way of knowing. The FDA label specifically says those doses must be taken with the evening meal. Most patients were never told that. What that means for you: the time of day and whether there is food on your stomach when you take Xarelto is not a small detail. It is written into the label for a reason. If you were taking daily aspirin before you were put on Eliquis or Xarelto, even a baby aspirin, even for years, this is the first thing to bring to your pharmacist, not your cardiologist's office, your pharmacist. They can review the full list in one sitting, and they're specifically trained for exactly this kind of overlap. The specific question to ask: I was taking daily aspirin before I started my blood thinner. Should these still be going together? That one question opens the whole conversation. The Pepto-Bismol issue matters specifically because of how ordinary it looks. It's not a supplement. It's not something that sounds like it could interact with anything. It's just the pink bottle you've had in the cabinet for 20 years. The same goes for Alka-Seltzer and for cold and flu combination products that have ibuprofen buried in the ingredient list under a brand name that reads as cold medicine. Before you reach for any stomach remedy, cold product, or headache tablet, turn it over and read 4 words: active ingredients and warnings. If you see aspirin, salicylate, or ibuprofen, that is the conversation to have with your pharmacist before you take it. Mary's Zoloft had been prescribed 2 years before the atrial fibrillation diagnosis. Her cardiologist who put her on Eliquis never asked about it. Mary never mentioned it because she didn't know those 2 medications were in the same conversation. That's not a failure on anyone's part. It's what happens when no single doctor has ever seen the full list. If you take any medication for depression or anxiety, any of them, prescription or otherwise, and you are also on a blood thinner, the specific question to ask your cardiologist is this: do my antidepressant and my blood thinner interact? And do you have my full medication list in front of you right now? Check what time you take your Xarelto and whether you take it with a meal. If you've been taking it on an empty stomach because that's when you take everything else, that's worth a conversation with your cardiologist. This isn't about changing your medication. It's about making sure what you're already taking is working the way it's supposed to. The specific question: I take Xarelto in the morning before breakfast. Is that right for my dose? Before I close, let me tell you what happened to Mary. When Mary brought the Bruising to her pharmacist, not her cardiologist, not her GP, the review took 11 minutes. The aspirin came off the list. The Pepto-Bismol was replaced. Her cardiologist was told about the Zoloft. 6 weeks later, the bruising had faded. What Mary understood afterward wasn't that she had done something wrong. She had done exactly what her doctors had told her. What had been missing was one person who could see everything at once. What I want to be clear about: the kind of bleeding Mary was experiencing is very often reversible when the cause is identified. When a conflicting product is removed from the routine, the body's balance can shift back within days to weeks. The bruising doesn't have to be the last chapter. It can be the thing that finally gets the full list looked at. This is general health information, not advice for your specific situation. For your own case, speak with the physician who knows your full history. You are someone who now knows what to pull out of your medicine cabinet today, what 4 words to read on every label, and exactly what to bring to your pharmacist before your next cardiology appointment. Because no single doctor may ever see the full picture unless you put it in front of them. If someone you love is on Eliquis or Xarelto, a spouse, a sibling, a close friend, and they take anything for an upset stomach, a cold, a headache, or anxiety, share this with them before their next appointment. They may have been told their blood thinner has no food restrictions. That is only part of the story.